That's July the 21st, and I wanted to address the issue about the ongoing coronavirus COVID-19 situation. Basically, as I guess a little bit news here, there's a new variant, a Delta variant's out there, and I've been tracking this situation pretty regularly. Basically, right up until before the 4th of July weekend, we were running at about the average 7-day average was up in the low tens of thousands, okay, and now it's above 30,000, okay. So in that 2.5 week period, roughly, there's been a significant increase percentage-wise in cases. Although the overall level in the low 30,000 cases a day is fairly low compared to the peaks where we were in the hundreds of thousands, back in January. So it's certainly accelerated, and I guess increasingly news says that the overwhelming majority of cases are now this new Delta variant, which I think came out of India, which is reputed to be more infectious, but there's no real evidence it's more lethal so far. I think there's still some controversy on what the exact effectiveness of existing vaccines is. Against the previous variant, I think that the messenger RNA vaccines were considered in the 95% level, and it may be a little bit lower for that. At any rate, I want to go into a little bit about this issue because there's also now discussion of certain areas such as LA and I guess Las Vegas is coming back with mask mandates. So I want to kind of get into that issue here. Now, if you like these videos, remember to subscribe if you're on YouTube account, and give me a like. And if you can, of course, if you also you could, forward these links to people that might be interested. Okay, let's get on this a little bit. A thing I would like to raise about the issue of bringing back mask mandates in the face of this is the fact that I question the effectiveness of public masking in general anyhow. Now, we have to make a distinction between the sort of protective measures that doctors and nurses dealing with COVID-19 patients would use, or lab technicians would use in dealing with this, and the kind of thing that the typical person out on the street would do. I mean, there's a big difference between using, N95 grade masks with face shields, gloves, using sterile technique on the one hand, and on the other hand, simply having a typical mask that people are wearing, whether it be a surgical type mask or just a regular, one of the other masks that are out there on the market. You have it in your pocket and just pull it out and put it on when you go into a store or someplace like that, or into an airport. I think there's two totally different levels of effectiveness of masks. And the question is, public masking, which I'm talking about, not professional medical masking. I'm asking how effective was it? And I would say that about 90% of the 34 plus million diagnosed cases or positive tests for COVID-19 that occurred during the pandemic so far occurred during periods where most people were under a mask mandate, and people were quite commonly obeying it. And yet, the infection surged almost completely out of control going into last fall and into early this year in the winter time. So it seems to me that this clearly shows that the masks are of relatively low effectiveness. In other words, look at two possibilities. One, you have a messenger RNA vaccine, Moderna or Pfizer, okay, or on the other hand, you simply are unvaccinated but wear a mask in public like most people who wear masks do, using that quality of mask and handling it in that way. So if the relative effectiveness is 90 to 95% for the messenger RNA vaccines and about 66% for Johnson & Johnson, the question is how much more effective is wearing a mask, how effective, first of all, is wearing a mask for unvaccinated. And I would argue, well, let's give it a benefit of the doubt. It's probably no more than a 10% effectiveness level by comparison. If you want to use your own numbers, you can do this. But it's obviously a lot lower because the pandemic broke basically when the vaccines became available and when most people started getting their first shot of the messenger RNA vaccines is when the whole thing started taking a tailspin, right? And by the time many people got 2 shots, the thing kind of died out. So the other thing to consider is this, that although there's still some controversies, it appears that there's a substantial amount of immunity that's obtained with those who have had the disease and recovered from it. And I guess there's still some dispute as to whether the shot is better or having the disease is better for future protection. And I guess, actually getting a test for the antibodies and determining what levels of vaccines produce versus the getting the disease would be a clear metric for that. But anyway, you get the idea. So what I'm getting to here is that basically it seems like either group has a high degree of immunity, and only those who are unvaccinated and have not contracted the disease are the ones that are really vulnerable to what's spreading right now primarily. Okay, so if you assume that the effectiveness of just wearing masks, as people commonly do in this public, when they're under a mask mandate, is about a 10% effectiveness level, and you have 95% effectiveness for the messenger RNA vaccine, okay, doing a simple probabilistic calculation in which you basically add the 2 probabilities of 95% and 10%, giving 105%, okay, then multiplying the 2, which you'd have 10% of 95%, which is 9.5%, and subtracting that from the sum gives you 95.5% effectiveness. So in other words, wearing a mask on top of having a messenger RNA vaccine should give you roughly 0.5% more protection than not wearing the mask and having the vaccine. Okay, so while there are breakthrough cases, as being discussed in the recent Texas Democrat House members going to Washington for their protest, you still see what I'm saying is that in general there is very little additional protection, and yes, there is possibility of breakthrough cases as well. And generally, I think we've found that people that do get it in these breakthrough cases typically have a milder case than those who, are totally unvaccinated. So my point is, bring back mask mandates is not a good idea and shouldn't be done. It really is a complete waste of effort, in my opinion. And it was probably essentially you could also have a rabbit's foot for luck as well, and it would probably do just about as much good for you, really. I'm being facetious here. 0.5% is better than nothing, I guess, but it's not really that significant. And yet this is being thrown out as like this is a real solution or this is going to help anything, and it really won't. The next thing I want to kind of address here is the reason for this surge. Well, you notice the surge basically started in the wake of the 4th of July weekend with a lot of travel, a lot of air travel, a lot of people getting together. And I think that in general that may be the root cause of what's happening now. And if you look at the population, roughly half the population have had both shots. And I don't know how many have had Johnson & Johnson because they're a little bit less protected level. And by the way, for disclosure, I do own some stock in Johnson & Johnson. So in a sense, I'm slightly dissing my own investment here. So and I don't actually own stock in either Pfizer or Moderna. So at any rate, point I'm making is, but I still think that the evidence shows that that's the relative effectiveness. And so I think that what we want to get to here is that, okay, let's look at the situation now with the public. If half the public is vaccinated, then if we add the other fact that there's about there are 34 million cases, and we figure there's a lot more cases that went undiagnosed because people just didn't go to the doctor for it because it wasn't that severe or it was even asymptomatic. I think I've seen estimates that roughly we believe about 110 million people in this country have actually had the disease and recovered from it in reality. Okay, so using that number and adding it to the other number, we get the fact that over 2/3 of the country already has a substantial amount of immunity to the disease already. So we only have roughly 1/3 of the population that's vulnerable. So I don't think this is going to, surge to the level that we saw last fall. Now, if I'm wrong, I'll be wrong. It is going up, but we don't know, first of all, will that trajectory endure for very long? And second of all, there's probably a cap on how bad it really can get compared to last time. And now we have better treatments. Well, the best treatment available, it's been shown that the hydrochloroquine ban was bogus. That's all. And there's another I forget to pronounce this. It starts with an I. The other drug too is effective. But really, right now, the best thing to use if you get it as early is what's called monoclonal antibodies, which was tested on President Trump, as you recall, back when it was in phase 2 or something. So that's now, I think, phase 3 approved. It's available, and I think it's what, if you really come down with it, and are really getting sick, that's what you want to get early on to treat it, and that should reduce the death rates. Okay. Now, a final thing I think is all this illegal immigration. We have over 1 million illegal immigrants in this fiscal year alone, and the numbers have grown substantially throughout the spring and into the summer. And so my point on that is we have a lot of unvaccinated people, so we're coming from a country that has a pretty high degree of infection, and these people are being placed in the most vulnerable groups within the country. Because the statistics show that African Americans are the least vaccinated group, and that Latinos are the second least vaccinated group. And there's a third group, which may be the hardcore conservative group that doesn't trust the government, as the other group. And so you may be seeing some of that in southwestern Missouri, for instance. But in general, I think that this influx of unvaccinated people carrying the disease throughout the entire country is also another factor that may be, stimulating these additional cases. And that's one thing that should be dealt with, it seems to me like. But of course, the current administration's open borders policy is probably now a key factor in spreading the disease to these otherwise groups that are supposed to be their core supporters. So, and this is something to consider, I think, also as this develops. So we need to kind of watch what happens here. There was an unusually high number reported last Saturday for the last Friday's number, and my thinking is that was probably a correction that counted some missing data from previous week or weeks. And so perhaps we'll interested to see if even the current average will flatten a little bit once that drops out of the average on Saturday, or will it continue to accelerate? On that, I think we have to keep an open mind because the data is coming in and we just don't know yet. At any rate, so I think this is one advice I would give to everybody is that if you haven't gotten your Pfizer or Moderna shot yet, and if you haven't had the disease, and another thing, if you haven't had a history of bad reactions to vaccines previously, I'd recommend going ahead and getting the vaccine. The groups I mentioned could hold off. If you think you've had the disease, you could get the antibody test to see whether or not you have inadequate immunity. Anyway, that's kind of my viewpoint for today. You can follow me on social media, also at the Twitter and Gab and Parler. The links, the addresses are below, and I'll close this for today.